All right. We have kind of leveled off in our attendees, and I guess folks can keep joining when they can. But wanted to go ahead and get started because we have a really great panel today. My name is Daniel Thompson, and I work at the CDC Center for Forecasting and Outbreak Analytics. I'm joined today by my colleague Andrew Rainey and Michelle James, who is at the Rollins School of Public Health. Andrew and I are CDC employees. I'll let Andrew introduce himself, but we're also a part of the CDC Employee Association of Emory Alumni. We are a full-fledged association at CDC with all the rights and privileges there too. We exist to be a connection between Emory alumni who are CDC employees or contractors or work at CDC Foundation, uh, and the Emory University. So we exist to provide some programming for you, to provide news and information for you. There is a listserv that I encourage you, if you are a CDC employee on the call, if you're not on the CDC EA listserv, to please join that. You can send a note to me, and I can get you that information. I'll put my email in the chat here in a minute. But I just wanted to thank our panelists today. We have two outstanding panelists with us here today who are going to share about their experience in international service and public health, what it is, and is it right for me? So we're going to do, they're going to do a presentation here with Dr. Baden and Dr. Grant Green, who are going to go over their career and some of their lessons learned. And then we're going to do a Q&A at the end. I encourage you to put your questions, should you have any, in the chat, and we will get to those toward the end. But for now, I'm going to turn it over to my colleague, Andrew, to take us through the rest of the introduction. Andrew?
Yeah, thank you for the nice introduction, Daniel. As mentioned, my name is Andrew Rainey. I'm a microbiologist with the National Wastewater Surveillance, graduate from the Rollins School of Public Health. And today we're honored to have two great public health professionals with us today to share their experiences serving in international settings. I'll start by asking our panel to introduce themselves, why they chose their career paths, what their experiences have been like, and any lessons learned that they'd like to share in terms of biggest surprise, disappointments, or other things that might have come up. And with that, I'll start with Dr. Baden, if you can introduce yourself.
Good afternoon, everybody, or good morning, good afternoon, good evening. I'm Dan Baden. I'm a family physician. I've been at CDC 22 years. I've been a Fed for 28. And I guess what got me interested in this is when I was 7, my dad got a sabbatical and he took the 6 of us in a VW camper to wander around Europe for 5 months in a confined space. And later, after med school, I had the opportunity to work in rural Ghana, setting up a rural health network. And my brother ended up going to Taiwan at the same time. And I remember my mother saying, "Why are you all leaving the US? What's wrong with the US?" And I told her, "Hey, you exposed us to the world very early and we all fell in love with it." So that was kind of how I got into this. At CDC, I've been a division director twice. I've been country director in Ghana and been chief of staff for this global health center. Currently, I run a program to help people who are returning from the field positions, reacclimate to working at headquarters. I can go on, or would you like to do an introduction of your end and go back and forth?
Yeah, we'll have Dr. Grant Green do an introduction, and then we'll jump into the panel discussion.
Hi, so good morning, good afternoon, good evening, everyone. I'm Grant Green. I currently serve as CDC's Regional Director for the Caribbean and Central America office in Panama. I apologize for the noise. It seems that at this auspicious moment, somebody's doing construction in the apartment above me, but don't worry, it's on theme. Flexibility is one of the big lessons I would say I've learned from my global experience. I am a triple eagle. I think Daniel and I were just chatting about that. So did Oxford, Emory College, and then came back for my master's in public health at Rollins before going on to do a PhD in epidemiology at the Miller School of Medicine, University of Miami. Voila, the noise has stopped. Prior to serving as this regional director, I was country director twice, like Dan, in Guyana and Haiti. And in between, I served as a regional associate director for our HIV, AIDS, and TB global programs in West Africa. So have had a bit of experience with CDC globally. I am an immigrant, so I think I've always been interested in the interconnectivity between the US and other countries in the world, particularly in ways which we can exchange lessons learned and help. So that kind of has been my passion about why I decided to go global. But let me turn it back over to our moderators and make sure I don't steal the show. Great to be here. Thanks.
Thank you both for the great introductions. And so with that, we will start to jump into our discussion with a career overview. And this can go to both of you jumping in, at whatever point you'd like, but we can start off with, sort of what interests you in your career paths.
All right, I'll go ahead. I actually fell into global health. I fell into CDC. It wasn't my plan. Like I said, after med school, I ended up working with an NGO in rural Ghana. I lived in a mud hut. My boss thought I would see patients, and instead I looked, and it was a town of like 800,000 people, and there was already someone providing care there. And I figured out if I come here, you've got a US trained licensed physician in this small town, I probably would get people to come to me and they would stop going to the other person. They would probably leave town. And then when I left, the town would be left worse off than if I hadn't shown up. So instead, I talked my boss into letting me set up a rural health network where we built clinics in 3 hub villages, trained village health workers around each of these hubs, and built a hub and spoke network that would then refer to the regional hospital for the cases. And I went back to Ghana 25 years later with Ebola, and 2 of the 3 clinics were not only still around, but had expanded. So that's what got me interested. Anyway, after that, I went up to Alaska and I did a similar thing where I trained community health workers to provide care in the bush. Then I went to DC and then came to CDC. But I had the opportunity to go back to Ghana, again with Ebola, but afterwards as country director. And it was just a great experience. I really liked either getting my hands dirty early on or working at the minister level later on. Just seeing the impact that you can have at a national level is extremely rewarding. You, Aaron?
Thanks, Dan. So my pathway was a little different. I actually, for my doctoral research, I compared HIV related outcomes amongst Jamaicans that were diagnosed with HIV and still living in Jamaica versus those who were living in the state of New York, specifically in the New York City metropolitan area, and had the opportunity to spend some time in Jamaica working with the health ministry while analyzing those data, and just found really fascinating outcomes, related to the effect of migration on health, despite there being access to really good healthcare. And that piqued my interest in looking a little bit more into systems, global health disease systems, and what were some of the barriers to uptake in services, even when they were available. So I did EIS, and then after EIS, I got the opportunity to serve as the country director in Guyana. It's a beautiful country, very small population, less than 1 million people live in Guyana, and you could fit the state of New Jersey in there about 13 times. So it was really a mixed model of health service delivery, lots of rural and remote areas, and just became increasingly intrigued in how we could help, and how, similar to what Dan described, instead of just kind of offering service patient by patient, client by client. How could we really work on building more sustainable, accessible health systems to close some of those gaps that we were seeing globally? So I actually spent another 8 years after that tour with our global HIV and tuberculosis division before jumping to the global health security side, which is a little bit of a broader disease agnostic approach to systems development. And that's how I ended up in this current position as our regional director at Gamma.
Those are both very fascinating pathways. I've actually been able to be in Guyana before, so it was a really nice country to experience. So to follow up on that, if you can just talk more about what your experiences were like during these different times in your life in these countries. I guess, somewhat professionally, and also any other personal notes too about your experiences.
Okay. I'm going to take this one first, give Dan a break from getting us off. So, I think it was the logistics of getting overseas. I don't think I realized how complex it was. So the application process was one thing, we've all applied for jobs on USA Jobs, interesting. But once you're selected, the timeline is the first thing. It takes a long time, right? And you have a family to consider, children, spouses that need to be registered for school. And so that's where that flexibility thing I was talking about really comes in early. I think one can never underestimate the value of cultural humility and cultural awareness entering into a new environment with a different set of operating cultures, not just the country, but the government institutions and the partner organizations. Everyone has their own organizational culture, and being able to be really cognizant of that and adaptable and flexible, I think is something that came through pretty quickly and is a skill that you'll probably use for the duration of your global career. And then just the differences in the environment. I remember being in Guyana and getting a call at the embassy that I needed to come home and put my dog away because they had spotted an anaconda in the neighborhood. That's not a call that you typically expect to get during the middle of the workday. So just that, no one can predict that for you. No one can tell you, hey, be prepared. There may be anacondas after heavy rains and they come out of the Amazon basin into the coastline of Guyana. So just that willingness to really be flexible and to have a sense of optimism. I think that was one of the things that I've experienced. Same thing in Haiti. We had tarantulas. I'm deathly afraid of most creatures. So that has been a huge adjustment. I think I've gotten a lot braver thanks to global service. And then the other thing I would say is just being in so many different operating environments, I feel like there's always an opportunity to learn something new. So having a lot of patience and having an open mind and just really being willing to accept and adapt and embrace new or novel approaches to getting things done has been an enduring lesson for me. And it has been really a privilege to be able to have some of those experiences. I think it has helped me even on the domestic side to be a better employee and a better team player, just based off of those learning experiences that you get overseas when you mix with so many different cultures and ways of operating. So I'm going to stop there and give Dan a turn.
So I think the day I arrived in Ghana back in the early 90s, it was the day that President Clinton was elected here in the States. It also happened to be the day that Ghana had their first election after multiple coups. And I had people come up to me and say, why did America have to pick our day to have their election? Couldn't they have moved it? And that was my first experience, first day. And it's like, okay, maybe we're not the only ethnocentric ones. And what I learned from that is everyone is focused on themselves, and that's okay. So how do you get engaged and live in that environment? You really need to focus on what's important to the people you're working with. So that was like I said, one of my first experiences, but it carried me through leadership positions then in country as well, where we may have ideas and different things that we would like them to adopt. But at the end of the day, they're going to decide what they want to do. And when you actually have things aligned where they adopt a policy that you are striving for, it's such a rewarding feeling. So those are some general thoughts. But when I think of other things about being there, I went with my kids, like Uran said, and like I had in the VW bus, I opened their eyes. I mean, they hated it. They were tweens or preteens, and they hated the experience. But now both of them, my daughter is teaching herself Mandarin and taking Mandarin. She's now thinking of getting a minor in Mandarin. My son taught himself Japanese, and he's thinking of doing semesters abroad. And so my purpose, one of them, other than having a great experience, was to open their eyes to the world. And I think I've succeeded in that now. It was painful getting to that point, but I think it's really rewarding. And now when they move overseas, I'll be able to say, why are you going overseas? But understand it's my fault.
Those were, great stories. I think both of you probably already touched on this, but we'll be, just ask more of a deliberate question on, some of your biggest surprises or lessons learned, or any of the, disappointments that you may have came across, through experiencing your work abroad. I guess aside from also anacondas.
So I'll go ahead and jump in. I think my biggest surprise was $30 a gallon milk. So we never had fresh milk. We would either get the milk that you put on the shelf and lasts for months, or powdered milk. And I didn't care for the boxed milk. So we had powdered milk for the entire time we were there. That took a little getting used to, but just you need to adapt to what is available in the area. The fruit, the fresh fruit was phenomenal, but the milk, no, not so much. Um, I think with regard to disappointments, you get so engaged with the community, whether it's the nationals or the expat community. When you leave and you come back to suburban America, it's a kick in the gut. It's like, okay, yeah, I know my neighbors, but I don't associate with them. No one understands what I've been through. But when I was in country, we would spend 2 or 3 nights a week just sitting on the porch talking with our neighbors. And you really get this sense of disconnectedness when you return. And people back at headquarters often don't realize the struggle you go through as you return, and they're not receptive. They're focused on getting the day-to-day stuff done, and you and your family are struggling with all these things you need to process, and no one wants to listen. So that's one of my disappointments, just losing that sense of community. And it'd be nice if we could replicate that here back at headquarters. Over.
So I think definitely, as I mentioned, the creatures were a big surprise, and they're everywhere. I still think of them not so fondly. I think another big surprise was just there were a lot of opportunities and spaces where I saw a great appreciation for the work that the US government or US organizations do. I mean, it seems so routine to us sometimes, but I remember going to clinics, and there was a clinic in Guyana I went and visited, and there was a gentleman there who had just buried his mom, and he said that no one expected her to live as long as she did. She lived to be 73. And she was HIV positive, and he said her first medication she received at a CDC funded clinic in Guyana when everyone thought she was not going to survive for 5 years, and he buried her 30 years later. So those kind of stories stick with you. It's really heartwarming, and it really contextualizes the work that you're doing, even if you're not seeing patients on a day-to-day basis. It reminds you the why. And I was surprised how much that motivated me, like at really tough points, really hard moments. Some of those moments flash in your brain and you kind of like keep going because you know you're working towards something that can be so literally life-saving when you're working in public health. And in the same token, I think some of the disappointments were, you know, when you land in a country and as a team you have goals and they don't always get achieved because there's so many external forces, including politics. And that can be disappointing. Sometimes you do leave with a sense of unfinished work or unfinished business that's beyond your control. But it's good to remember that public health is, you know, it's a community event. It's a relay, right? So you just have to pass the baton and Dan, what's happening here? Okay, sorry, he was disappearing. I didn't know what was happening. But you know, I think the disappointment of not finishing something that you start can always be a little bit jarring, but remembering that you're a part of a bigger team effort, a bigger organization effort, and you're going to pass the baton. It's not that the work won't get done. It's not finishing on your shift. And I think the other thing that was really disappointing was sometimes ground truthing realities. I lived in Haiti for 4 years and had a lot of preconceived notions and perceptions based off of how Haiti's population was portrayed in the media, stories I had seen. And when I got there and, you know, really started working with different parts of the country, different parts of the population, I was actually disappointed. I was happy because it was a beautiful experience, but I was so disappointed to see the disconnect between what's portrayed in the media and what the actual truth of the situation is on the ground. And I really have become a much more responsible consumer of media news and other news information based off of that experience. So I think those are my two biggest disappointments.
Great, thank you so much. So we've got you know, a fair number of current Rollins students on the call, as well as, you know, CDC, Emory alumni, and so we'd really love to hear from both of you. And Dr. Baden, I will start with you. Some options for getting started in international service, and maybe if you have time, some hurdles for getting started. So, you know, you can think about your answer or respond, you know, for the early career person who may be, you know, relatively new in public health. How do they get into international service? You know, maybe the mid-late career person who, you know, maybe wants to change or is interested in shifting to international service. And then, you know, any ideas or thoughts you have in terms of, you know, what might be some of the opportunities for getting in there, putting in your application, clicking send. You know, what are the avenues for that? And we'll start there, Dr. Baden.
Okay, so I'll start with early career and then hand over to your end. But with early career, it can be hard to get into international or global health. It's kind of a chicken and an egg thing. You have to have experience in global health before you can get into global health. And how do you get that experience? So it's challenging. And a lot of the careers, the positions in the field at CDC are mid-level career. There's no entry-level careers internationally. So you have to spend your early years building that base of skills that are going to be applicable in the field. You can work on language skills. That's always going to be useful. French, Spanish, and the one people don't think about is Portuguese. Those are the most flexible. You can also, I mean, Mandarin, Ukrainian, Vietnamese, Hindi, all these others are useful, but they're very limited in scope. Being able to speak Mandarin isn't going to help you if you move to South America or Africa. So language skills is something you can do early on in your career. One way to get experience internationally is Peace Corps, and you have hiring benefits when you finish, where you can get into positions much more easily than going through the full USA Jobs route. Another one that's probably most applicable for people who are still in school or recent grads is CDC's PHAP, the Public Health Associate Program, which opens up every year for 1 week. It's highly competitive. It will open up probably in late January, early February. But you are brought into the government. You have 2 years in the government, and ideally you can then convert or switch to a full-time career at CDC. But you would be working in a state or local government, building those core skills, things like project management or some technical skills or policy communication skills, budget skills, some of those types of general things that are needed everywhere at CDC, including in global health. If you get the opportunity to do, I mean, going on a trip doesn't get you any credibility, like for a vacation to Cancun or something. Going on a mission trip potentially gets you a little bit more. A semester abroad, okay, you're getting a little bit of experience doing time. That sounds bad. Working overseas for a temporary duty, a 2 or 3 week assignment, that gets you a little bit of exposure. Living overseas is really how you get credibility. And people want to know, do you know what you're getting into? Because one of the worst possible things is we hire you, we send you overseas, we spend a couple $100,000 to move you and your family there. 3 months later, you or your family decide, this isn't for me, and come back. And then you have to be replaced. And like Yoran said, it takes multiple months to get to the field. So the country is then lost hundreds of thousands of dollars and doesn't have someone in the position for months and months. So it's really important to know and demonstrate that you know what you're getting into ahead of time. So those are just some general thoughts. Yoran?
Thanks, Dan. So I definitely concur with the language. The language skill set, that's something that can be done early. I think that really for me was a huge negotiation and bargaining chip for entering into the global experience. If you're still at Rollins, and I think if you're between your first and second year, I think they have global field experiences or Jiffies. I don't know what they're called now. I'm dating myself, but I think that's an excellent opportunity to gain some applied public health training and skills in the international realm. There are other fellowships at CDC. I think Dan mentioned PHAP, which is great. A lot of the fellowship tracks do offer opportunities within CDC's Global Health Center. That's where the majority of our global work originates. That center has 3 divisions, an immunizations division, a division that works on global health protection, including the global health security agenda, and then the global HIV and tuberculosis division that does the President's Emergency Plan for AIDS Relief, or PEPFAR. Those are kind of the anchors of our country offices overseas. Those are the core programs that we use to establish overseas presence, and then other parts of CDC may leverage those offices. So you can always enter on the domestic side, right? Because there are huge support groups within the Global Health Center for our overseas assignees, and it's a great way to acquire some of these global health specific skills, to apply and demonstrate your acumen in your specific field of interest. And it creates a pathway to an overseas assignment. I know this is a CDC Emory alumni meeting, but in all fairness, there are other organizations within the US government that have really strong overseas presence as well. And we do get people moving between organizations. So, I encourage you to cast a wide net if you are interested in really getting overseas first. And sometimes we do look at that overseas service from another organization as advantageous for CDC. So I wanted to be fair to our sister agencies that are working overseas. And then the other thing that I would also recommend is if you're in a research realm, there's a lot of overseas research opportunities, K grants, really starting out if you're interested in independent research that can also afford you that overseas kind of orientation. NIH Fogarty has a few programs. So there are a lot of government pathways that you can kind of dip a toe in the water And then I will say that for those of you who are at CDC currently, the international experience called AIDA is a great way to test the water out. You can apply from any government HHS agency, and you spend about, is it 4 months, Dan? 3 to 4 months? Thereabout, in an overseas country office for CDC. You get a temporary assignment, you live in that country. So it's really a great way to test out if this is for you. So that's called the AIDA. Thank you, Fran. 3 months. The AIDA Fellowship for existing CDC employees who are considering making that shift from domestic to overseas is a great way to test the water as well. I'll stop there. Thanks.
Thank you so much. That's really helpful information. What are some of the differences in your mind, Dr. Grant Green, with temporary versus long-term assignments, and also, differences between working abroad versus working domestically on global issues? I think Dr. Baden, he has done both, and I'm sure you have as well. But if you could just talk about, sort of those temporary and long-term assignments, and then a little bit of the difference in where you are working.
Great, no, great question. So I think, as mentioned, the temporary assignments really do afford you a great opportunity to test the water. It's a shorter term stint. I did forget to mention that another way to serve overseas is during an outbreak response for CDC existing employees. So that can be especially if you have a complex family structure or it's a critical time point for your children or your spouse, it may not be the ideal time for a long-term assignment. Do consider a temporary or short-term assignment. It's a great way to really still get some of that experience we're talking about to make you competitive without completely, uprooting your life. I think, as Dan alluded to, the long-term assignments can be life-changing in many positive ways. Yes, there are some struggles, but I think that the opportunity to see the world through a completely different lens, it's hard to put words on it, but it really grounds and reorients your perspective to service and public health. That has been my experience. I think that some of the differences, I do feel, interestingly enough, that there's a little bit more flexibility working overseas. I love the ability to adapt and adjust program implementation in real time based on kind of a constant feedback loop. I think my experience has been that's a little bit harder domestically. So just, you kind of stay the course domestically until there's kind of a larger, sometimes external force that modifies. So I like the adaptability and the flexibility of overseas work and programs. I also like the unpredictability. Some people like kind of consistency. I like change. I'm motivated and energized by new opportunities to do things differently. And I do find that overseas, I get that a lot more. Not just, year to year, but even moment to moment based off what's happening in the country. You usually have to adapt your programs, especially to align it with your host country government and make sure that you guys are in sync. The other thing I like is the exposure to different parts of the US government. I think I have a better understanding of our larger US government structure and operating in the interagency space because of the time that I've served overseas. Organizations that I probably would never have come in contact with if I were not in an overseas location. Right now I'm in Panama, and there are 9 Department of Homeland Security agencies here. I've never been in a post with so many Homeland Security agencies, so I have a richer understanding of that part of the government now. So I do think those are a few advantages that I have found from being overseas, just that greater US government understanding, the flexibility of the programming, and an opportunity to really, I think, innovate a little bit more than what I have personally experienced on the domestic side. So I'll stop there and give Dan a turn.
So I think there's a fair amount of difference between doing a temporary duty or a short stint versus living overseas. I'm reminded when I was in residency, I went and heard this musician, and she was singing a song about how you want to be a traveler, but you'll always be a tourist. And that struck home with me. When you're on a temporary duty, you're living in potentially a five-star hotel. You're going out to eat every night. You're there, you're focused, you're energized. You're not having to deal with the day-to-day things because you know you're leaving in 2 weeks or 3 weeks. When you move somewhere, reality sets in pretty quick. You're living in a compound, probably with guards at least, potentially armed guards. You may or may not be able to travel around town. Um, it's a very different experience. You are totally immersed, but you're also hobnobbing with ministers and able to impact policy on a national scale where you often can't do that when you're back here in the States. Um, you get opportunities to do things that you would never have in the States because there's a limited pool of people who are available to do such and such. You're going to be doing interviews, be on TV, giving talks, giving presentations, different things like that, that if you're back here at headquarters, most likely someone higher in the chain is going to do. Let's see. You also have to deal with the realities of your family, getting into school, or if someone gets sick, or dealing with your family who's back here in the States and your siblings. One of the things that often happens when someone comes home is the siblings will say, now that you're back, it's your turn to take care of mom and dad. It's your turn to do such and such. So when you go in a TDY, you often are leaving spouse and family behind, and it's just a little break. When you go to live somewhere, you're hopefully taking them with you, but sometimes there's posts where you can't bring your family, and that's a whole different ball of wax. Trying to figure out how to deal with those family relations. I mean, life is hard on its own, but when you throw in the dynamic of being in a different country with or without your family, there's lots of stresses that you have to deal with. If you're just going for 3 weeks, most people do just fine being separate for that amount of time. So lots of challenges that have nothing to do with the technical work that you're doing that come into play. But I think temporary duties or TDYs are a great way to get your feet wet. Like Yoram was saying, AIDA is that's kind of a nice in-between step. And again, you get to find out whether this is really for you or not. And then moving overseas for a two-year assignment that could turn into 4, 6, 12 more years, something like that. It's life altering. Over.
Great. So that's actually a really great transition, Dan, that you were talking about lifestyle changes, considerations for housing and things like that. So that's really feeding into our last question, and we'll want to try to keep this last one a little brief so we can open it up for a Q&A as well. But we just wanted other considerations and expectations for, your lifestyle changes, things like security that Dan had mentioned, housing, healthcare, and, just acclimation, going out to and coming back from these trips abroad, and, just other considerations for, physical health, mental and emotional well-being as well. So Dan, I guess you can follow up if you have any others. I think that you were already touching on a lot of these things. And then we can follow up with Dr. Grant Green for this last one.
Okay, so children is a biggie. Younger children tend to do better. It's almost an expectation that you'll get house help, nannies or different things like that. So you try and have support. The post or the embassy tries to help you get support for living and succeeding in the field. Another one that people don't think about is parents. We're all getting older all the time. And when someone starts declining, their health starts declining, often you need to help out. Your siblings can push along that line as well. But I've known people who bring their parents to post, and it's potentially a great opportunity for them as well. So there are options, but it is definitely a consideration. And just talk with your spouse, talk with your family about going. So they really know what they're getting into as well. It's important for you, but if you are with someone, if they're not doing well, you won't do well. So be very open and frank with the people you live with to make sure that you're all ready for a life-changing experience, which can be fabulous, but it is stressful. So you need to be prepared. Over to your end.
Yeah, I think definitely consider, as Dan mentioned, the distance away from your home base and what would be practicable for you. I think that, also as you're considering your family, the linguistic differences I have found, your family can feel really isolated. When we were in Haiti, because of the security restrictions, my partner could not really go out and find his own community of friends. So we all got together on the compound that we lived in because it was the only place we could gather safely. And folks were still speaking French. And so even though he was physically present, there were a lot of times where he did not feel included. And that's something that you have to consider really closely. It can be hard on the family structure, and even you, the employee, getting pulled in a lot of different directions, representational events after work. You can spend a lot of time away from your family unit. And then I think just being prepared that everything is a trade-off. So you can have this amazing experience in this new country and just really be living outside of work. But you will miss milestones, high school reunions, college reunions, family reunions, depending. There's a lot of lives, exactly, anniversary. There's a lot that you may be missing at home, and you can feel alone, even with a network in your new setting, being disconnected from your core friendship or kinship network. You can feel a little bit isolated and alone. And it's hard work. It's hard work in that work is not very 9 to 5 or 7 to 3 the way it is in the US. You spend a lot more time, I've heard consistently, pouring into work and that effort. So I feel, I feel like just being prepared for that. Sometimes I don't get to enjoy the country as much as I thought because of the volume of work that has to be done. And also just resiliency, really checking in on your resiliency and your cues that you're approaching either burnout or an excess level of stress, especially in countries where the security environment is not as firm, where there's fluid security. You can hear a lot of protesting. You have countries where, you can hear a little bit of violence. There's gunshots. So that can wear on you over time. So just being really in touch and in tune with yourself and being sure that you have mechanisms to get support if you need it. I think that's critical wherever you serve. So I think I'll stop there so that we can have time for questions. Thanks.
Awesome. Well, thank you both for those insights and sharing your experiences. Like I said, we do have a few minutes left for Q&A. We want to make sure that if you have questions, we get those asked and answered. So I will turn to the chat now. And again, if you have questions that you'd like for our panelists to answer, please go ahead and put those in the chat. I'm going to look here and make sure I'm not missing any. This is not directed to either of you, but I'll just read it. Does prior work experience for international students, is that the same as having international experience? Do either of you know about that? Dr. Grant Green, you're shaking your head.
Yeah, so as an immigrant and an original international student before getting naturalized, it isn't the same. So being from another country isn't quite the same as working in public health in a foreign context, right? Because for us who are international, that is our home context. So it still doesn't quite translate to kind of cultural sensitivity in the way that they're looking for when they say, have you had prior work experience internationally? So it's a nuance. It's a great question, but we wouldn't, when we're reviewing applications, look at that the same way. It doesn't mean that there would not be consideration for the fact that someone has lived in a foreign environment before, but it wouldn't translate one to one. You know, if you lived in your home country for 6 years and worked, we're not going to consider that 6 years of international public health experience.
Understood, understood. Dan, do you have anything to add?
No, I think she's covered it well.
Okay, very good. Next question. Are there opportunities for an internship that goes overseas? Is that, would you consider that Peace Corps, or is there something in CDC or State Department or USAID?
I think PHAP has, I don't know if they've implemented it or not, but they've started talking about doing assignments to some of the territories, like American Samoa, potentially Virgin Islands, Puerto Rico, different things like that. That's not true international, but you're starting to get some of the experience, and you could probably sell that as a challenging environment that has given you some degree of experience. Other than that, I'm not aware of any. You're in?
No, not so much. I do think that there are a few things I may have dropped one there. Like there are a couple Fulbright and Fogarty like internships, but in all fairness, I think those are anchored to like a pre-existing assignment, whether it's as a researcher or student. I'd have to look more into that, but I did drop the Fulbright link in the chat, so that may be a good place to start looking at it. It's a little bit more like a fellowship than an internship, though.
Awesome. Awesome. Thank you. And just wanted to remind folks, I'm sure if there's any Rollins students on the call there and they're in global health, they know about the global field experience, which is I think a pretty good experience. I was not global health when I was at Rollins. I was HPM, but don't forget about the global field experience for those who were interested in that. Okay, moving on. Can one of you or both share examples of what the closeout process looks like as you are leaving a post? Are you working on reports your last few months? What does the passing the baton look like in practice?
Okay, I'm gonna start and then Dan, I'm gonna pivot to you. So I think that this is one of those things that we always idealize, but in practice, it doesn't quite happen as neat and tidy as I think any of us would hope. So for me, in the beginning, I used to try to do like these rich handover notes and like drafting a current state of affairs of every agreement that we touched, which was fine when I was working in an office that had a $10 million budget. Once you start to get to a 60, 70, $100 million budget, that gets really hard. So I think the first thing is to have a good documentation and cataloging process of the work that you do throughout your tenure. That's the best way to really prepare for a responsible handover or closeout, because it's going to be virtual. It was really difficult to try to do that in the last 3 months. That being said, the handover process is not always very clean. Sometimes you're leaving your post before a new assignee has been selected. So there is kind of no one who's going to be in your analogous role that you're aware of yet. So I think it's a good pitch for teamwork, right? Delegation of responsibilities, having good transparency and visibility of the work that you do along the way, so that there's nothing that you should do that's a black box to the people that you work with. So your team should be able to really help onboard the next person if you're able to act transparently. There are certain security related things that you can't share at that level, and those are the things that I would focus on cataloging or creating secure documents that would paint a picture of the current state of affairs. We also work a lot with our headquarters teams for support, and that's a great mechanism to say, hey, heads up, for the next person that comes in, here are a few things that you should be working on or they should be attending to. But it's complicated because you might be either moving to your next post or looking for your next job. So the transition periods can be quite complex overseas, getting established, and also when you're leaving, getting packed out. getting your car shipped, getting your children enrolled in school in the new place that you're going to. There are a lot of competing priorities, both personally and professionally. So I think the passing of that baton starts earlier in the relay, and just making sure that there's good awareness around the work that you do and the strategies that as a leader you might be implementing, so the next person can get that benefit of that info from your team, from your HQ support, all the mechanisms that you have for communication, so that it doesn't rest singly on you.
So I think I would echo what Yoran said. The work doesn't stop just because you're leaving. And as you are preparing to leave, you have all these stresses of packing out and, like Yoran said, trying to figure out next job, family, all these different things, plus getting documents or things set up for whoever's going to come to replace you. But you have your full-time job, which is more than a full-time job because of the time differences and things, working with headquarters on top of that. So it can be really stressful. And then some people know what their next job is going to be. Some people do not. Your spouse often will not have plans. Your kids are wondering. Sometimes your kids may be in boarding school or different things. So how do you get the family back together? So it can be a really stressful time. And again, it's really important to be frank and open with the rest of your family, and with headquarters, saying what you're struggling with, to try and tap into any support that there may be. What I encourage people to do is plan. Don't think of coming back to the States as going home, because you've changed, the states have changed, you may be going to a new position, there's lots of change, so it's going to be different. I advise people to think of this as moving to a new post, because when you go to a new overseas post, you anticipate that it's going to be challenging. You gird yourself for challenges and problems. But when you think, I'm going home, oh, it's going to be great, and then you start running into struggles, it really can devastate you. It's something called reverse culture shock, and it can last for months and months. So leaving well is really important, and it's hard to do when you're overburdened. Over.
Great. Thank you. Good advice. So we have two more questions, and I want to be cognizant of time. So this question coming up, and then one more. This question for someone who has an MPH and more than 10 years of experience in international development and global health security. Do you have any advice on making a mid-career leap into CDC, and advice on how to make the jump from a home office to the field? Anything about that y'all care to comment on?
I'll jump in. If you've got 10 years experience, you'll likely have a lot of skills that will be transferable to the field. So you're probably in a reasonable position to apply. Do think about applying to domestic sites of CDC. You can apply for headquarters global positions as well, but don't rule out the domestic ones, because you can move from domestic to global within CDC, as long as you can demonstrate you know what you're doing. So I had a thought, but I lost it. Yoran?
Yeah, thanks. I think that's great advice about just applying to CDC in general. But if you are it sounds like you have a home office that works, that has projects or programs in the field, that may be a way. You're already in that organization, so that might be a great way to get that international experience we were talking about, that would translate on top of your linguistic capabilities and years of experience if you're applying to a CDC global position. So I think if you have the opportunity to get some field experience, that could go a long way to complement the skills you already have, and then that can make your transition into the CDC, whether it be global in the field, global at headquarters, or a domestic position, that much more, you'd be that much more competitive.
Great. So our final question is from Dee. I don't know if Dee is still on the call. I had a follow-up question for her, but her question to the panelists is, can they speak to the importance of diplomacy? And if it is considered for global positions, I'm not sure if that means professional experience as a diplomat, but I'll leave it there. And Dee, if you want to come off mute and explain a little more, that'd be good too. But I'll stop there.
Hi there. Yes, I was recently applying to a overseas position, and one of the preferred requirements or competencies was diplomacy. And I didn't quite understand what they meant and how I could demonstrate that, being that I've worked domestically at the CDC for 10 years. And how do I get that credibility to say that I have diplomacy skills?
Such a great question. And I think you probably saw Dan and I with very animated reactions because you can be the most seasoned scientist, medical practitioner, clinician. And if you don't have that diplomacy, I mean, it can make or break your overseas experience. I would argue that it's probably one of the most critical skills that you can have. And I think when we're thinking about translating your skill set domestically, globally, I think we usually think a little bit about interpersonal skills. We usually think a lot about that cultural awareness and sensitivity. We think about internal customer service as well as external customer service. And if you were to bundle all of that up and then add to it the ability to potentially negotiate, right? I think Dan spoke earlier about kind of finding those common goals, common objectives with host country governments, with international partners, because we, CDC, may have one goal, but if it's not aligned or synchronized with the partners that we're working with and with the host country government, we may not be able to accomplish it. So if you put all those soft skills that we just talked about together with the ability to negotiate, I feel like you'd start to chip away at the concept of diplomacy. It's not just this ability to work well with other people, but it's really leveraging certain skill sets to be able to find a common goal that is still going to help your organization achieve what they set out to achieve in that operating environment and meet some of the expectations or goals of your partners. And those partners are sometimes internal to the US government. We have to practice a lot of diplomacy with sister agencies like the Peace Corps, like USAID, like the Department of Defense, depending on what we're working on, before we even start to think about striking diplomacy or diplomatic engagement with our host country government. So I think there's big D diplomacy and there's little d diplomacy. Big D being that the act of being overseas and having to engage with foreign entities, but little d being these skills and this approach to work that we talked about. Because there's very little that CDC does in isolation of other partners and the host country government. Let me turn over to Dan.
So I think I've got 3 points. The first is when you're in country, you are always on, like on camera. Everything you do will be seen and reflect on the US government. You do not get time off. Even if you're off at the beach or something, you are always representing the US government. The second is find common ground with your partners. Again, whether they're domestic, other US agencies, or international partners, find ways to make everyone succeed. You are so much more successful if you're doing that rather than just driving your agenda home. And the last one, one of the questions that will often come up in interviews and things is, tell us about when you were working with a difficult person. So if you think about some of those interpersonal relationships, and if you can talk about how you were able to rebuild the relationship to one where it was a positive relationship, that's all diplomacy. It's interaction between people, finding common goals, finding successes for everyone, and realizing that everything you do reflects upon yourself and the country. Over.
Just wanted to say thank you to both of you so much for giving us your time, knowledge, experience, insights to everybody. I think most people left to jump off to their 1 o'clock meetings. But for those of you still on, thank you for joining. Please reach out to Daniel if you want to join the listserv. I believe Dr. Baden also provided his email in the chat. Dr. Grant Green, you may also, if you want to, or we can send that out at another time if you would be open to other people reaching out to you. But with that, I think we will wrap it up. And once again, just a very big thank you to both of our speakers today.